more will join over. Right, good morning, everyone. Welcome to this seminar on university staff well-being. I'm Nick Powell, Chief Executive of the Society of Occupational Medicine, and we are hosting this session for everyone. Very pleased to do so, and I'm the annoying person that's been sending you Outlook invites, but every day or two. So thank you for going to delete, but it's just the way I work, and I'm sorry about that. I'm Chief Executive of the Society of Occupational Medicine, and the Society of Occupational Medicine is a professional body for occupational health professionals, including people who work in well-being, and we produce the Journal of Occupational Medicine, lots of member benefits. But really, I suppose what we want to highlight today is an issue in terms of occupational health and well-being in the university staff sector. We've also looked at other sectors with Gail Kinman, mental health of nurses and doctors. There's certain sectors that concern us, and I think this is fair to say this is an area of concern. And we did do a freedom of information request, which I know is going to be covered later by Siobhan, in terms of spend, which shows huge variation in university occupational health and wellbeing spend over the years. And you can't look too much into that, but the fact there is variation, you wonder what is going on here. A big thank you to all the speakers, particularly to Professor Gail Kinman, Siobhan, and colleagues in Education Support for their fantastic report, which they're going to run through. And also big thanks to Nicola Neath, who's going to be chairing today. I'm going to be coming in at the end to sort of look at what the next steps are and how we can work together to advocate and lobby for change in this area and improvement and recognition. Certainly we did that with mental health of nurses and doctors, led to changes. I think it's difficult sometimes to see where change happens as a result of one thing to another, but certainly people like the GMC and the RCN and in that sort of nurse and doctor space have taken on this issue. The RCN have got a big campaign on sort of supporting nurses, obviously under pressure. So we want to be that advocacy policy sort of champion for this too, and let's see what comes out of today. Really looking forward to it. And as I said, use uni staff wellbeing as your hashtag if you're on Twitter or whatever social media platform you like. Without further ado, I'm going to hand over to Nicola Neath as your chair for this morning. Thank you, Nicola.
Thanks, Nick. That's a lovely beginning. So before I get into the introduction, what I'd like to invite everybody to do is to take a couple of moments. So have a shuffle in your seats. Make sure your posture is good. That kind of matters. Try and get your feet flat on the ground and take some breaths. Check that there aren't any distractions. If you can close your Outlook or email or turn your phone over, just so that you can have some time, give yourself some time to take in the information from this morning, which will be recorded as well. So anything you don't remember, you'll be able to check. So it's about lowering pressure and expectation. I'm really delighted to be chairing this morning's session, as this is a real passion of mine. As well as being the chair for the mental health group on the Council for Work and Health, I'm a workplace counsellor based at the University of Leeds in our staff counselling and psychological support service. And thinking about wellbeing and mental health has never been more nationally significant. I have an amazing boss who knows her craft as a line manager as well as a psychotherapist, and has also spearheaded the application of mindfulness in organizations through mindfulness-based stress courses, but also other applications. And we have an enabling director, and I'd like you to really hold on to the word enabling. He has supported and facilitated our work in connection and collaboration with our occupational health colleagues, with HR, other professional services, academic colleagues across the piece. And as a consequence, we have developed substantial systemic provision to support our staff through in-house counselling, training, line manager support, coaching and bespoke offers. And our joint passion is to grow our emotional literacy, all of ours, to work with the changing needs of the organisation and our people and to meet them with humanity and care wherever we can, to offer them professional role-based interventions where needed, or support and care for the life events that they might find themselves in. It's not perfect, work is really hard, but we're getting there. But all universities are different, just as you are. What has worked for us won't be the same for you. And that's a really important part of today's context. So wherever you're from, I'd like to encourage you to think, as you listen to these wonderful presenters and panelists, where are your points of influence? Who are your collaborators and enablers? Working from the HESA data, universities employ about 250,000 people, I think, have around 2.7 students. So that's nearly 3 million people affected by the work we do. But of course, universities aren't just HE providers. We're connected economically to the places that we're based in, from housing to leisure, policing, transport, the arts. And we're also part of the fabric of our bridge to the future, as well as part of resolving the problems we have to manage in the now. Some are collegial, based around colleges, some are based around schools and have faculties in them. Some have faculties with schools in them. Most have chancellors, vice chancellors. Some have executive boards, management teams, presidents, provosts, governors, you name it, they've got it. So whilst they might all share being part of HE provision and a bridge to the future, they're all quite different. So well-being provision appears different in different places too. All provide some form of mental health support for students, and some of these places are support for staff, offering counselling from 30 minutes to an hour, one session, to open-ended. EAPs, online provision, internal support, and internal services, and a rarely hybrid. That's what we have in Leeds. So wellbeing and mental health support can also sit in different places, in secretariats, in HR, in wellbeing, if there are wellbeing services, in health and safety and occupational health, in professional services, embedded in HR or not. So where does it sit in the universities that you're either in or supporting? And where might it be if it isn't there? What will surely become true is those institutions who understand and hold their part in well-being and the mental health of staff will be prizing their greatest asset, their people. So here we are on Armistice Day, in the heart of the fourth industrial revolution, that history may surely define by the pandemic, by environmental and mental health awakenings. So as you open up and listen to our presenters and panelists, who will introduce themselves, I'll invite you to consider, how are you? Are you okay? And what might you need for yourself? How can you be a part of the change needed to support staff across all universities? How do we make connections today that are lasting? And how do we mind our duty of care, preserve our creativity and well-being in the here and now and for our future? So on a final note, as it is Armistice Day, we will observe 2 minutes silence at 11 o'clock in between Gail and Siobhan. I'll invite you all at that point to switch off your videos and mind the time for us all. But now, may I ask you to lend your interest and your curiosity to Professor Gail Kinman.
Thank you very much. I'm just getting this up. Okay, so can everybody see my slides? Nicola, just nod. Thank you very much, Nicola, for such a lovely introduction that really encapsulates, I think, what the issues are. And I think it's great, you know, sorry, that was mail coming through my letterbox. I do apologize. Okay, so I'm going to be really setting the scene for today by providing an overview of research that we have conducted in UK universities for around about 15 years. You know, I've been looking at this topic since 1996, which is quite a long time, obviously. But we will be focusing on 4 surveys that we've been conducting, and focusing specifically on the 2021 survey that was commissioned by Education Support. And obviously this was commissioned at a time of considerable stress for the country in general. The data were collected in the early part of this year. But Siobhan will then go on to expand on this survey, the most recent survey, and focus specifically on support needs of staff and recommendations. So, right, we're going to be looking at the changing landscape in higher education. I'm sure you would all agree that things have changed, particularly people who have been in this job for quite some time. Things are continuing to change. Then we will be just having a very brief overview of the findings of this research, the several waves of research in higher education, focusing first of all on the psychosocial safety climate, which is the general climate of well-being in universities. Secondly, emphasizing the importance of benchmarking well-being. This is the approach that we've been taking over a number of years, where you can not only compare the findings over time on key psychosocial stresses, but also compare them with benchmarks and other occupational groups. So we'll be looking at the Health and Safety Executive Management Standards approach and some comparative data there. Then a brief overview of the findings on mental health in higher education, and just finishing up with a very brief overview of some of the other risk factors we've identified. And then, as I said, Siobhan in the second talk after the silence will be looking at the support needs. So what about this changing landscape? Now, I don't really need to go over this very much because I'm sure you're all too familiar. Now, it used to be thought that working in a university was, a low stress environment, collegiality, etc., was a very supportive type of environment, and people had a lot of role flexibility. But of course, we know more recently that there has been rapid and very wide-ranging change, and change is continuing at a very fast pace. We know also that working hours, even though working hours are increasing, it's the intensification and the demands that people have to fulfill in these working hours. So the job itself is becoming much more intense. We know that the student population has changed considerably. There is rising student to staff ratios. The student profile is rather different. And of course, they may need a lot more support and a lot more input. There is an increasing reliance on customer service metrics, not only from student satisfaction, but also judgment of the quality of people's teaching and research in these league tables. We know also that managerialism has been increasing, and this is from studies around the world in higher education, where people have been reporting that they feel less control and influence over the job that they do. And as I mentioned previously, reduced collegiality and increased competition between institutions for students and research funding, and also between individuals sometimes as well. So the collegiality has reduced. We know also, and this will be mentioned later, that the job has become increasingly casualized, and it's not only academics that are often in insecure contracts, but also support staff as well. And finally, the pandemic, has increased problems for everybody. But there is some evidence from several studies that we look at in the introduction to our report that workload has increased, resources have reduced, and support has also been challenged during this time. Okay, so first of all, the psychosocial safety climate. Now, this is defined as a shared perception of organizational policies, practices, and procedures that protect workers' psychological health and safety. Now, this is seen as of key importance to well-being. And this is based on data that we got in earlier this year. And I think, one of the most important findings is that nearly 8 out of 10 respondents strongly disagreed that senior managers consider psychological health, their psychological health, to be as important as productivity. So that is obviously of concern. 73% again strongly disagreed that communication about psychological safety issues that affect them is good. And certainly what we found in previous research is that there may well be, and Siobhan will talk about a bit later, there may well be some support there for people, but often they don't really know about it or how to access it. So that's particularly important. 67% strongly disagreed that senior management show support for stress prevention through involvement and commitment. So, again, with the psychosocial safety climate, really important to be seen to be involved and committed. And only 2%, very concerning, strongly agreed that psychological well-being is a priority in their organisation. And I think you'll find, from the research findings that we're focusing on today, that we do need to emphasise the need for it to be a priority. I'm sure most of you are familiar with the health and safety management standards, so I'm not going to be going in too much description of this, but obviously organizations have a duty of care to protect health and well-being. It's not just a legal duty of care, it's also a moral and a business case, because if you protect the well-being and support the well-being of your staff, they will be more healthy and they won't leave the job. So the HSE have developed this risk assessment process to benchmark well-being. And the benchmarks are based around 6 areas of work activity that we can see here in this slide. So we've got demands, we've got control, we have support that is measured separately for colleagues and from managers. We have the quality of relationships that covers things like, harassment, bullying, etc., as well as, the general quality of working relationships. We have role, the extent to which people feel that their role is clear. And we have the management of change. And there is a traffic light system to identify areas of concern, and it then helps organizations prioritize change. So just going to show you a rather busy slide. I do apologize for the busyness of this, but this is really just setting out 4 separate waves of findings where we have used the health and safety executive standards. So this allows us to track well-being based around these areas, these really important areas over the years. And I think sometimes a bit counterintuitively, we need to remember that higher scores equate to higher levels of well-being. So basically higher scores are good, lower scores are bad. So as you can see, demands fall well below, so I do need to say, first of all, that all but control fall into the HSE's urgent need for action category. So that is the red traffic light where things, intervention is needed. So demands are a particular problem. Management of change is a particular problem. But control, although it just about meets the benchmark, we found that over the 4 years, this has been eroding significantly. So whereas control could counteract the demands, from very many areas that academics and support staff and academic related staff face, as it's reducing, its beneficial effects are also reducing. Manager support is also a particular problem. Peer support, although it still falls below the expected level, is also a more positive factor. So we have published a paper on the differences between the waves, and if you are interested, just get in touch with us and we can give you more information. But this shows the strength, I think, of the benchmarking approach, that we can monitor well-being over time. So what about mental health? Well, we know that this is actually fairly poor. And one of the first studies that I did in universities in the UK is going back to about 2008. And I used the general health questionnaire that actually highlights the proportion of your sample that is designated a case, which really means that they should have some kind of input to support their well-being. And then it was around about half, it was about 52–54% caseness. And in one of the study that we did in 2014, interestingly, it was around about the same proportion as well. And again, I think very interestingly, in 2021, this year, post-pandemic, during the pandemic, we have also found that around about half of the participants do have signs of mental health problems. So this does seem to be a generally stable effect that's happening over time. So in 2021, we knew that well-being is considerably lower than population norms because we have studies that are able to compare that. But in our own research, 29% showed average well-being, and over half showed signs of depression, 53%. In terms of burnout, 29% felt emotionally drained every day, but we also looked at other concerns relating to mental health that are very important, you know, in a working environment where people were saying they had low energy, low confidence in doing their job, difficulties relaxing and switching off, also feeling socially isolated. Now that may not be too much of a surprise because of course, you know, people were working at home and there was a lot of social isolation feelings that came out in our survey, and also low optimism, you know, for how things were going to be in the future and in terms of how improvement in their job. So just finishing up now, really, thinking about some of the other risk factors for health and well-being that we've identified in our research over the years, and particularly, I think, focusing on the most recent survey. So we've found that something called illegitimate tasks, which is a really interesting idea, where people, it really refers to the extent to which the tasks people do are seen to be unreasonable or unnecessary. And this really does hit a bit of a chord with people working in universities in terms of perhaps increased bureaucracy, where a very high proportion of people do tasks that they see as unreasonable, either often or frequently. And again, I think, you know, 56%, so well over half, do tasks that make little sense often and frequently. So, you know, this is an area, I think, that really does jump out, that does need a review in terms of the tasks people do, and involving staff in co-producing interventions to perhaps question some of these tasks. Then we have role creep, which I think is a wonderful term, but actually it really does encapsulate the excellence that people, particularly academic staff, have to demonstrate in teaching, in research, you know, IT specialists, particularly over the pandemic, etc., entrepreneurial activities, effort reward imbalance. Now, this is a model that we've used in our previous research, and this is all to do with perceptions of equity between the efforts that you believe that you put into your job and the rewards that you believe that you get. Now, we don't just work for money, we also work for job security, esteem and respect. And there is a considerable imbalance here between these efforts and rewards in the sector. Work-life interference, again, is a particular problem. And this is a theme that's been coming out of our research for many, many years, and also research by others in different countries, where university staff can often have weak boundaries between work and personal life. And it isn't just the demands that they have to fulfill. It's also the feelings of involvement and overcommitment towards the job as well. You know, for a lot of people, their job is their hobby. And of course, before they know it, the job can take over their personal life as well. So having this boundary between work and personal life is very important. And I think it's kind of exemplified here by more than a third saying that, that they always or almost always neglect their personal needs for the job. And finally, and we've recently published a paper on this, if anybody's interested, get in touch and I'll send you the information. Whereas sickness presenteeism is very common in the sector. And I think it was mentioned earlier, wasn't it, in terms of people working while sick. It's much more common, we found, when people work at home, because it's all too easy, isn't it, you know, for people to just continue to work, even from their hospital bed sometimes. So 79% work while sick at least sometimes. Now, obviously, we realize that people can have just, you know, coughs and colds and sniffles and whatever, and sometimes working can be beneficial, but we are talking about serious illness sometimes as well, a reluctance to step away from work. And the reasons here are pressure of work, clearly, fear of work being undone. You know, when you come back after a period of sickness, it's all piled up and nobody else has done it. So you have to deal with your current workload, but also the workload that is undone as well. So some of our participants were saying it's actually less stressful to continue to work than it is to take time off. Lack of flexibility also in terms of meetings, preparation for exam boards, etc. Teaching also has to be done. So it may be postponed when you're off sick rather than cancelled, or somebody else will do it. So then it's the catching up when you come back. Feelings of obligation and guilt. Again, you know, feelings of concern about students and colleagues, and, you know, what they are likely to have to miss if you take time off sick, and overloading colleagues who are also suffering, you know, with heavy workloads. Feelings of job insecurity, that's a particular problem for precarious workers who feel often that they may not be hired again if they're seen to be kind of unreliable by taking time off sick. But I think overwhelmingly as well, we have to emphasize the strong feelings of commitment that people have to the job, and, you know, this feeling of duty to continue to work. And finally, I think, and this was particularly interesting in terms of the enjoyment of the job. As one person said, well, you know, what would I do if I wasn't working? I just get bored, so I may as well just continue to work. So it's a very complex picture, I think, but we do know that presenteeism can challenge people's well-being. So I'm going to finish now just by introducing the issues that Siobhan's going to be talking about after the silence. So, you know, we'll be looking at the data from the 2021 survey that focuses on support needs. We're looking at the support that is available, the type of support that is most and least appropriate, and the support that is effective, the barriers to implementation, because clearly, you know, there could be support there, but you may not be able to access it, and how these barriers can be overcome, and the importance also of evaluating their effects over time. And finally, here is a list of research that we've been referring to. So if anybody wants any copies of papers, just get in touch. Thank you very much.
And Gail, could I just confirm that your slides might be available after today?
Will be.
Okay, that's great.
Yeah.
So people will be able to pick up those references. And there's been a question and an answer in chat, but maybe just in the kind of minute we've got left, just to confirm who this research is based on. Is it academics and non-academics?
It's academic and academic related staff. You know, the academic related staff are librarians, IT specialists, etc. But we do recognise, you know, and we are emphasising very strongly that we do need to know a lot more about support staff, because they're very much under-researched. And that is a big concern for us.
So maybe a takeaway from today for us all as well. So what we'll do through the presentations, we'll try, and Nick and I will be monitoring the chat, so you can put your questions in there that we could feed into the panel. We probably won't be able to answer all questions, but do capture your thoughts and your questions as we go along, so that we can put that into, you know, kind of capture it as a consequence of today's meeting. So that was brilliant, Gail, and I think that was a great pace to go through the slides as well, so thank you. So we're moving towards 11 o'clock now then. So what I'd like to do is, could you please all put your videos off, and I shall put my video off as well, but obviously for a few minutes keep my sound on. Our next speaker, Siobhan. Siobhan, you'll say a bit about who you are as well, and invite anyone else who would like to put their videos back on to do so as well.
Hello, can you see my slides?
Yes.
Yes.
Thank you, fantastic. So my name's Siobhan Ray, and I work quite closely with Gail. What I'm going to talk about today is focusing on the Education Support Partnership Commission working this year, and specifically focus on support and the information that we gathered around the availability of support and the usefulness of support for university staff in the UK. I will talk a little bit about the demographics, and I did see a question in the chat just a second ago, so I will talk about that as well. So it was an online survey that went out to participants between March and April this year. 2,046 respondents, just over half were male. Nearly 86% of respondents were in an academic role. Those that were not were in academic related roles, and I think it might be useful to define that. So academic related staff are staff that are in roles such as digital learning, library staff. There is some question about some teaching staff being in academic related roles also. They may be in more management roles within the organisation as well. What that doesn't cover, and I think this is something we will talk about, and I think it is a takeaway from today, is it doesn't cover other staff in universities, of which there are many. So administrative staff, I think that the question in the chat referred to staff such as, gym staff, estate staff, etc. And they are a very, very under-researched and underrepresented group. And I think it's as we move forward to thinking about universities and university wellbeing, that's a key area that we need to focus on moving forwards. The majority of the people that responded in either type of role were in permanent contracts, and I will pick up on this a little bit later. 11% in fixed term contracts and about 8.5% in other types of contracts, including 0 hours contracts and the like. So it's just a little bit of background, really. So we asked participants to rate 47 potential sources of support, drawn from the literature and a pilot study to identify what sources of support were available, what people would like to see. And they ranged across a number of categories, work-life interference, health and wellbeing support, counselling, coaching, stress management services, training, social support and relationships, organisation policies and practices, managing workload and pressure, reducing bullying and inequality, and external professional support, for example, from trade unions and professional organisations. So on the screen in front of us, you'll see that what we've done is looked at these in terms of those that were perceived to be very effective, so the top 10 most effective forms of support by percentage, rated helpful or very helpful, and then the availability of the support, again, rated by percentage. I think it's really interesting that the most significant or the most helpful form of support that came out, 92% of participants agreed that this would be helpful or very helpful, is feeling appreciated and respected. And I think that ties back very interestingly to what Gail spoke about a moment ago around this idea of esteem and respect being important parts of working within a university environment. The ability for work from home, again, very high. Unsurprisingly, we were still in a working from home environment at this point. And I think that there is interesting work to be done with this as we move forward, both in terms of academic and non-academic staff whose working roles and jobs have altered and changed as part of the response to the pandemic. We've mentioned presenteeism already, and again, this encouragement to take time off when unwell is something that's come up again very strongly for people. And I think this is again important across all forms of staff within universities. But this idea that there is an acceptance, willingness, encouragement from the organisation that if you're unwell, you shouldn't be working, is very important. And I think if we look at the availability of that, being at 38%, it tells us something about the if you like, the rift between those two areas. Timetabling again comes up. I think this is very much for academic staff, this idea of timetabling work so that people can take breaks in between teaching sessions. Again, 81%, but availability very low. So this idea that there's again this mismatch maybe between the work that people are doing on the ground and how that work is organised, I think is very key. Managers are aware of the pressures of the job, and I do want to talk, I'm going to talk a little bit at the end about managers and line managers and their role in psychological wellbeing in universities. And again, a mismatch here. People feel it would be very, very helpful and very supportive, but the level of availability quite low. Formal opportunities for input into decision making. Again, people feeling that it would be a very useful, very helpful form of support. Again, something that's not necessarily, or people don't perceive to be very available. And this, I think, talks to something about how do we address this, which we will move on to a little bit later. Encouragement for support for a culture of teamwork and collaboration. I think those two things are linked. I think it's this idea of working within teams, collaborating, ensuring a collegiate approach to both teaching and learning, research, but also organisation of institutions. Trade union support and guidance was very important for people, as was access to flexible work options. And we've said above the legal requirement there. So by that, we're asking whether or not there's availability for a more personalised flexible work options. So we look at the least effective. We've got things like group counselling, which wasn't considered particularly effective and wasn't available. So there are things we're doing potentially right. I don't think group counselling would be top on the list for our suggestions in terms of a way forward. Support and guidance for personal issues, individual focused stress management training, guidance on work-life balance. There's a difference in these less helpful options in comparison to our most helpful, in that they tend to be far more individually focused. A lot of the most helpful things that people identified tended to be at the organisational level or around the kind of work that they do. The responses that we got around more individually focused interventions were that they are potentially less helpful. And there are a number of reasons for that we will talk about. Some of the responses, we asked people to talk to, write to us and tell us about and explain some of the responses they've given. And in terms of those organisational levels of support, there was a feeling from the qualitative data that an emphasis on individual issue, or the emphasis on the individual rather than the organisation, made it very hard for people to engage with those individual support packages. So this sense that, not tackling the cause of the problem, maybe too much work, is a barrier to then thinking about mitigating symptoms or reducing symptoms. There was also issues around this idea about whether it's organisationally appropriate to talk about stress and well-being in the workplace. So, that maybe the culture of universities means that people are unwilling to talk about these things, and that cultural and organisational cultural change needs to occur in order to support that. And this comment that there's lots and lots of policies. We have universities love a policy, we do. So we have policies and all sorts of things, and rightly so. Whether those policies are then translated into the lived experience of the working day is something that was questioned in some of the comments that we received back. Then there's a load of other barriers, a load of practical barriers. Counselling services having huge waiting lists. There not being anything locally available. So the feeling that resources were external rather than internal or available at a local level. And this fear and stigma around saying that you may be struggling, and all came up as quite strong barriers for against accessing any form of support. And there were other barriers. I've talked about stigma and fear, but the idea that the support that's available is either not fit for purpose, poorly designed, or isn't tailored to the sector came up a number of times. A lack of time to access support was something that came up, or to action. Indeed, both access or action positive strategies was something that came up time and time again. There were concerns regarding accessing services through a line manager for varying reasons, and in part because if the issue that you're having is with your line manager, then going and asking for support in that situation can be difficult. But also, this relates to this final point, was concern for the well-being of colleagues and managers. This acceptance or awareness that line managers were also under a huge amount of pressure and stress, and therefore were unable, or people were unwilling to then add to their line managers' concerns by addressing their own. So an awareness that this wasn't just something that was necessarily happening at one particular level, but throughout the organisation. As Nick mentioned, I think it was really interesting freedom of information request from the Society of Occupational Medicine, and they asked for, to receive details of university spend on occupational health and wellbeing between 2015 and 2020. 133 HEIs were contacted. Data was received back from 37, and 97 didn't provide any data. And what is interesting is the occupational health spend ranged, of the total spend across the 5 years, ranged from 11,500 to 1.5 million. So a massive range there. As Nick said, it's very hard to then disaggregate what that means. Organisational size differs massively across the sector. And when I was looking at the data, the 11,500 comes from an incredibly small organisation, so that may explain their low spend. But we need clarity about what does high spend mean? Is high spend meaning that there are excellent resources in place, or does it mean that people are requiring specialist help more often? So I think that's something we need to work on and disaggregate as we move forward. So I really want to just finish and think about what on earth can we do. And Gail and I, as you will no doubt realise, have talked about this for many years. And I think there is, the data does tell us that there is a requirement to tackle this at in a multi-level way. And those levels need to be integrated. So, we need change at the organisational level, work to improve the culture of HEIs, active organisational monitoring, reporting and actioning of risk. And I know Alex is going to talk about that shortly. Collaborative discussions. We think that, esteem, conversations, input into decision making were all really important for staff that responded to the survey. Having organisational collaborative discussions and co-produce work around what happens in your organisation is absolutely key. Because as Nicola said at the beginning, HEIs they're so different across the piece. So it's important to do that. I would also argue for a more sector kind of input as well from our sector stakeholders. We do need to have a review of current services, and we do need a regular auditing and assessment and evaluation of what services are useful and what services are not, both in terms of use, but also in terms of, overcoming some of those barriers to use. We need developments of programs that are underpinned by evidence, and we need to be really collecting and celebrating, good practice within the sector. Yes, there's some stuff around line manager training and support, but again, that needs to tie into the primary level. We can train line managers to be, effective at managing stress in organisations, but only if they have the power or to action change in the areas that are required. And obviously, we do need to have those appropriate tertiary options in place for people to access support regularly that is appropriate for the roles that they're in and is appropriate for being a member of staff in that area. And again, I've talked a lot about examples where counselling is shared between staff and students, and staff will often be sitting in a waiting room with students at the same time. So we need to think about what works there.
Right.
So I think there's a lot to think about as we move forward.
Indeed, Siobhan, loads of food for thought. Thank you so much for all of that. We have got quite an interesting discussion, growing lots of areas for to take hopefully a little bit into the panel afterwards as well. So thank you very much. So I'd like to introduce our next speaker, please, Alex. And Alex, if you let us know a bit about yourself at the beginning as well, that would be great. I think you might be on mute. There we go.
Okay, here we go.
Perfect, thank you.
Thanks very much. I'm having an issue getting this set up actually. Can you see? Can you see the?
I can see your whole PowerPoint presentation at the moment. So if you go to slideshow, will it do it?
Yes,
there
it
you
working?
go. Perfect.
Okay. Thank you, Nicola. So I'm Alex Lancaster and I'm UCU Bargaining and Negotiations Official with a focus on health and safety. So often referred to as the National Health and Safety Official, which is not quite my title. But I will say that obviously we welcome a lot of the discussions today. UCU, we represent 130,000 academics, lecturers, trainers, instructors, researchers, professional services managers, administrators, so on and so forth, librarians, postgraduates across higher education. And we also represent staff across academic staff across further education, prison education, and adult and community education. So I can tell you that workload is an issue, a huge issue, and stress is a huge issue across all those post-16 education sectors. So I'll just start. So one of the way that UCU approach tackling stress at work is through a health and safety approach. And the reason that we do this is that stress is a workplace hazard. You know, it's discussed in great detail by the Health and Safety Executive. And as a union, we've published a lot of guidance, stress toolkits around how to reduce stress across workplaces. And that guidance is obviously geared towards upskilling our reps and in particular our safety reps. Now, employers do have extensive duties under health and safety legislation. They have to ensure a safe working environment for their employees, and they have to do that by undertaking risk assessments that capture all the hazards in a workplace. And you'll note that a lot of health and safety is traditionally focused on things like chemical safety and trips and falls, which are all very important, and asbestos management and so on and so forth, and very little on stress. And obviously we've been working hard as a trade union to try and change the narrative and to get employers to understand that stress is a high risk hazard within their workplaces that needs to be prioritised. Now, obviously central to a lot of the health and safety legislation and the work that UCU does is the role of safety reps. And the role of safety reps is enshrined in the Safety Reps and Safety Committee's regulations, which clearly outline the statutory functions of safety reps and the role they play in supporting employers to manage health and safety across their workplace. And that includes managing stress as well. And I have to keep saying that because although we might understand it, it just doesn't happen. And you can have a look at your own safety committees, you could look at the minutes, you can see whether there's a safety policy in place, you can see how stress risk assessments are used or not used across your organisation, and really get a feel for how seriously the organisation is tackling stress as a health and safety hazard. So obviously, a big part of what UCU does is campaigning and organising around these issues so that we can promote improvements to working conditions for staff across the sector. And we do work jointly with other unions such as Unite and Unison in this endeavour, and safety reps work jointly together quite frequently. Another thing that we do at UCU, we do sit on a national forum, which Vinny, who's speaking after me, may discuss, which is the HESH Forum, the Higher Education Forum, where we discuss health and safety issues. And UCA, Universities UK, the joint unions, and also HSC and lay reps will sit on, and USHA, sorry, the University Safety and Health Association will also sit on on that forum, and we do try to promote some good practice and work together on guidance for the sector. But you know, we are still seeing that there isn't a sector-wide approach. The buy-in into these approaches is not, it's either limited or it's not as widespread as we'd like it to be, and not as impactful as we'd like it to be. So obviously the main approach is seeking joint working and also collective agreements with employers. So things like workload agreements, embedding stress, risk assessment across organisations, embedding them into policies and change management procedures and things like that. So now I can't see my own title on the screen. So health and safety reps and joint work with employers. So we know that the union effect is huge. TUC have done research on this, and where there's a union presence and active safety rep engagement, we know that injuries and ill health are halved and organisational safety culture is massively improved. So getting involved with trade unions and working together with employers is a vital part of improving health and safety and wellbeing across our higher education institutions. We do promote and obviously encourage safety reps to take their full statutory functions, and that means that employers have to give sufficient time off. Safety reps are actually entitled to as much time off as is reasonably needed to perform their statutory functions, and they have a much stronger right to that time off than other union reps. And they are also to be proactively consulted with by employers on all safety related issues or significant safety related issues. And you will have seen that during the pandemic with the huge engagement and great work that's been done by safety reps working closely with employers to improve safety management during the COVID pandemic. Now, the risk assessment approach is obviously a systematic approach to identifying potential risks. So it would avoid, you know, cherry picking wellbeing initiatives or pulling out initiatives without any evidence base. So you would identify the hazards, the drivers of stress in the workplace. And to do that, you consult with safety reps, you consult with your workforce and other stakeholders, and you identify what the root cause is. And health and safety legislation requires employers to prevent stress in the first instance and follow the principles of prevention, which are enshrined in the Management of Health and Safety at Work regulations. Now, that requires employers to first look at the cause of stress, to eliminate it or avoid it, to put in place mitigations that could be engineering, they could be administrative, they could change the way they manage the workforce, the way they operate. And you know, the secondary and tertiary measures that have been referred to in the presentation by Gail and Siobhan, we also know that these have less impact, but they are also much lower down on the hierarchy of control that employers are required to follow as part of the health and safety legislation. So we see very much the recommendations coming from Education Support Survey as being in line with the requirements on employers under health and safety legislation. And we really need to bear this in mind when we look at our strategic approach. So the UCU have conducted a number of surveys over the years, over decades. And we do have a workload survey, which is a national workload survey, which does look at the pace and intensity of workload, the volume of work, and it looks at a number of issues that arise under the HSC stress management standards, which I know Gail referred to in her presentation. So things like the amount of control you have, the demands on your time, you know, the amount of change that's taken place and how well that's managed, and role and relationships and the support that you get. And so the workload survey really does draw out the workload as a driver of stress across higher education. It is one of the main drivers of stress, and working time and pace of work. It was last run in 2016, and we've just launched a survey again in 2021, and we do get a significant uptake and participation in this survey, and we do get to see and examine the size and intensity of workloads over time. So hopefully we'll be able to share that with you in the new year in 2022. We also have an equality survey, which we ran in December 2020. We run branch level stress surveys to try and build up evidence base to work with employers to tackle stress in a meaningful way. And UCU have produced stress toolkits and guidance on undertaking stress risk assessments. And we have webinars available on our website that we've recorded, as well as breakfast briefings where we've talked about things like stress inspections, and ways that reps can really work with employers to tackle these key issues. Just not sure how I'm doing for time. So some of the key issues that we are finding.
Got about another 4 minutes.
Okay, in that case, there's a lot of stats here on how workloads are unmanageable, so I'll skip through this. And obviously during the pandemic, one of the most stark findings that we found in the equality survey was that 30% of survey respondents felt that their employer's approach to risk assessment during the pandemic had not been satisfactory in relation to protecting their mental health and well-being. And of course, as is demonstrated in the education support survey, we do see increased levels of stress caused by increased change, increased workloads, and we do see an equality impact to that as well, with women and facing a more significant increase in workload. And all Black, Asian and minority ethnic groups are also more likely than white staff to report their workload increasing. We've also, obviously casualisation is also a key stressor within higher education, a key cause of stress in the workplace. And the widespread use of casual contracts is of great concern to UCU. And you know, we do struggle to engage with casualised staff, but we have a survey of 4,000 casualised members in higher education. And you can see that a large proportion are struggling to make ends meet, struggling to pay bills, and reporting that their insecure contracts is making it hard for them to future plan, to manage their finances and make plans with their families. And it's obviously having a significant impact on their mental health. And many have considered leaving the sector due to job insecurity. So if we take an organisation-wide approach to stress risk assessment, you will see that, you know, all of these things should be captured in an organisation-wide preventative stress risk assessment. Job insecurity, casualisation, workload, all should factor very, very in a major way in an organisation's preventative approach to stress risk assessment. You know, I think the findings from the education support survey, they do present a very stark picture of the reality of working conditions within the HE sector, which we have known for decades. But it is obviously quite scary to know that staff are at breaking point and that more than half of staff do have depressive symptoms. And I do find it very interesting that when we benchmark with the HSE standards, that we are classed as a high-risk sector, and urgent action is most definitely needed to protect employees. And I will say that it is also required of employers to protect employees from psychosocial hazards in the workplace. And if they fail to do that, then we must escalate our concerns. And we do have, of course, a regulator, the health and safety executive, who will be able to intervene in the most severe cases. So I think I'll just go on to maybe my last slide.
Thanks, Alex.
So we need senior level buy-in and commitment. Employers can put in place steering groups for stress and improving mental health. They can set up stress forums. They can ensure it's a key issue within safety committees. There's a number of solutions that have been identified by Siobhan and Gail in their presentations, and we can use all this sort of evidence to make sure that employers are tackling these issues in a preventative way and at the organisational level, and that is the priority. And they also then build in secondary and tertiary measures for where we've not been able to prevent stress and where staff just need that extra support and well-being, and that is readily available. And that the managers and senior level managers in an organisation are committed to making these improvements. So I think I'll leave it there.
That's absolutely fantastic. And we do appreciate these are huge areas for us to be thinking about. And in a way, what we're doing is we're opening these areas for discussion, as well as sharing ideas about good practice, which are also starting to come through chat too. So please do try and capture your questions that we might put to people in the panel section afterwards. But in the meantime, I'd like to introduce you to Vincent. Vincent will say a bit about who he is and his presentation too. Thank you, Vincent.
Hi, good morning, colleagues, and thank you, Nicola. I shall try now to share my screen and look for your inspirational thumbs up, Nicola, if I may.
Yes, you've got
right.
it.
First test pass. Now, is it? I'm looking for. Okay, are we all good?
Yeah, perfect.
Excellent. Thank you very much, and thank you for the prompts, Alex, as well. I will remember that collaboration we do. First of all, ladies and gentlemen, as you can see, Vincent King, proud to be presenting here as chair of USHA, University Safety and Health Association. I shall talk a little bit about USHA, but I'm also head of health and safety at City University of London. A bit of content of what we're going to go through today. I want to give you a bit of a high-level summary of managing occupational health within an institution. And we may recall earlier on Nicola's helpful summary of how each institution is quite unique and there's a large population involved. And I'll try and draw some of those issues out and how it impacts on individuals in a variety of different ways. Look at some of the wellbeing initiatives that we should hopefully all be relating to, some quite mature in our institutions, some not, but we should hopefully be relating to a lot, I say. And then at the end, I'll highlight some useful resources that the association's put together with colleagues. So first and foremost, who are we? Who is USHA? Well, it's a member-led organisation of mainly health and safety practitioners from institutions in the UK and also around the world. We've got 140 members, and we have, I'll say the first time today, we've been in existence now for 50 years, promoting health and safety. Yes, exactly, thumbs up. Promoting health and safety across institutions and improving the working lives of people associated with that. We do a lot of work developing good guidance with collaborations. And again, through the pandemic, we've made massive strides working with UK, UCEA, DFE, etc., and Department of Health to try and get across what it's like working within an institution through a pandemic. And again, with trade union colleagues as well, producing good materials to help that as well. And we kind of collaborate in an open and transparent way to try and improve the working life within the sector. There's a lot of material. If colleagues want to look at our websites, please do. You'll see a lot of good work there, and hopefully there's a lot of members on the call now as well. So that's enough about USHA. What I really want to do is just talk you through the things that you should relate to. Nicola mentioned about each university is unique. When you look at the estates of which we operate within, it is when you start to see the differences. We have campus-based universities and we have commuter HIs. Each one has separate challenges. And again, we'll touch on the pandemic, how it's come out more. But let's talk about scale. Either of these could relate to some 500 buildings. I've got colleagues north of the border. Their institution relates to 500 buildings, and some be as small as 10 to 15 buildings. That's a huge variation. Some of these properties could be owned, leased, or rented. And when we start to feel of the impact that may have on the working environment, we're starting to see how different and how challenging that could be. Throw in again the seasonal variations of weather. You may already be dreading going to work sometimes. So again, it's a big place, the environment as well. And again, our residential accommodation, some of the issues that brings to the fore. And again, some's on-site and some's through rental nominated agreements. So it's not a perfect model. It's quite a multifactorial issue at an estate. And again, they are abroad as well as within the UK. All these need to be managed in communications. It shows you how fragmented a university could be. And let's not look at our structures. We talked before, I think it was alluded to, nearly 3 million people are associated with higher education. And again, some of those could be lean, flat structures. Some could be quite healthy and layered. So again, penetrating through those structures is a challenge in itself. So how we communicate the message. So the estate really has a huge impact on the environment as well. Now, when we talk about the hazards we're all familiar with, depending on the size of the university, the type of research it's involved with, we we should all be familiar with the type of hazards, mechanical, radiation, biological. Hence, we have a lot of professionals in these particular areas. We can put in controls. But the red thread, or the common thread, whoever you are, is a psychosocial aspect. Work has a massive impact on individuals, whatever you may be. So again, that is kind of the red thread there. Whatever institute you are, we need to look at the psychosocial hazards and mitigate and control them as well coming through. Whilst we have a distributed estate, we could argue, so is our workforce. There's no one workforce the same. And then again, we talked about that. We could be living in a city or in the country to get to work. That too has its challenges. If you look again in the cities, and again, whether it's in London where I am or major cities around the country, housing costs, rented accommodation, nothing's all the same. And all these impacts, they're all part of an equation really, of where we could be out into the countryside with the fresh open air. And the next point is also quite, and it's come out in the pandemic, transport. We have to get to work, whether it's public transport, rail, tube or bus. That could make a difficult journey up to work on the day, or whether we just drive into the open campus that some people may do, with a lot of open space and fresh green air. So again, all these little things are starting building up and into impact on the day. And coming out in colleagues' survey earlier was mode of employment. Again, fixed term, full-time, part-time, a variety of different days of the week. And that has to be managed and it's all to be treated equally. And again, the same way. So that brings challenges as well. So there's no mode of employment the same. And again, the demographics, and we touched on, Alex highlighted earlier, the impact of COVID on certain ethnicities as well. We need to look at that in terms of how we manage mental health and stress in the workplace as well. And not forgetting the fact that whilst we have staff in the UK, we also have staff abroad. If you're an employee, we should be treated equally and the same support given there as well. And the homework interface, whilst historically people have always worked from home, academics perhaps more than most, but through the pandemic, we've all had to work from home for a variety of reasons and long periods. And that has really brought into sharp focus the challenges. And when you link the homework interface to whether you're living in a city or a country, each one has its own personal challenges as well. And all that's come out. And we have to remote manage. There's a common thread developing already we can all relate to. It's about managers, management style, and we have to manage. We've all had to learn quickly through Teams. How can we manage and do appraisals on a screen? Are we picking up them personal cues that we would have in an open conversation? So remote managing has not been easy. And again, a lot of comments here on that. All has to be managed and controlled. Most people will have occupational health and safety management systems that have been quite mature. We've been developing these over years and they are quite mature and embedded. Some may not be, but we'll highlight materials later, with a nice suite of procedures to cover them and a wide range of competent people to support them. And we're starting to see that where we may not have that competence, we can develop business cases. We'll touch on later how that comes through. And that's where Usher and it's linked with various associations, you develop that competence to support managers to implement those policies and procedures there. And again, we don't do this in isolation. Whilst we support management, we work collaboratively with our recognised trade unions, Alex and Unison's on the line later. And again, there may be areas where there's not recognised trade unions. So we then deal with representative employee safety. So there's people where there's trade unions and where there's not. So again, there's two aspects to that as well. And again, that's embedded and we work through that. We'll highlight here a critical point that we do have to monitor all that. And there should be structures. Alex highlighted our consultation forums, that's good. And the 3 points there in red that are highlighted, we should be using our data to drive that engagement, to drive that support and get the buy-in from management. We would all relate to accidents and we all report to that. UC have produced a very useful and helpful annual survey. We should all be tapping into that. But we should also be looking at our occupational health service, our EAPs where we have them, and our staff counselling. They all provide useful data that we could turn into reports to highlight the problems, shine a light on the issue, and we could advance that further and turn that into pounds, shillings and pence in all money. These are the tools that we could influence people at a higher level, and we should be using more of that going forward. So what I've just kind of give you an overview there is what we should be seeing in place in most of our institutes now. If not, there's a couple of pointers of what you might want to be looking forward to doing. Before the pandemic, there was evidence that stress was growing within the sector, and then we hit the pandemic. It's very difficult to say it's reversed. If not, it's going to get worse. And again, when we looked at the pandemic and the isolations, for most people, my pandemic started in January 2020 with returning students from China, and it's been ongoing ever since. And those systems had to be nimble and agile to respond, to create that safe work environment for staff and students. So it has been a challenging period, but we should be working collaboratively to put those things in place. Hopefully all what I've gone through there at a high level, we can relate to, and if not, we need to just home in on a few little points there. I want to touch on where I think the real benefits can come from today's session. Within that, we'd all talked about primary, secondary, tertiary interventions, quite common language. We look at primary, looking at here, filtering, screening, exercise with occupational health to make sure people are fit for work, etc. And also health surveillance practices. But we should also be looking, as Alex has highlighted there, risk assessments. And this is where the difficulty is in stress risk assessments and identifying the structural changes that may need to be required. And that's a difficult area to come to terms with, and we need to drive that through first there. The big point I'd like to talk about a bit more, if I could, the secondary intervention. And I'll take us back, if colleagues can recall, early 2000, when we started talking about the coincidence of concern. It was Professor Cox in 2006, talked about your healthy life settings and how the workplace could influence that. And I'm sure we've all now got a healthy wellbeing agenda about health promotional activities, whether it's eating, nutrition, exercise, started off with smoking. All those things are well embedded, and they're a wonderful event that goes on. And when we all do them, all the dark days that we have, they go away when we see friends and colleagues, and we all recollect how good it is. And then the problems creep back when those promotional days have gone, they've ended. Why? I put management development. Your manager today is a huge role, it's a huge task. Who is a manager of today? Are they a counsellor? Are they a doctor? Are they an accountant? Health and safety experts? employment? All those issues, and that needs development. And that needs constant development to upskill a manager to make sure they can put all those things in place for staff and regular communication that will build that resilience going through. The last point there is the tertiary aims. We should all be familiar with Occupational Health Service as well. Employee Assistance Programme. So proud today. I built a business case to get an EAP at where I am at City. We've got them on site today promoting the service for the first time. It's so hard to launch these wonderful services through a pandemic, and you just have to keep grinding it through, and hopefully we get better penetration. And staff counselling. I know Nicola's at Leeds, I've got a staff counselling service there. Not many institutions have. I'm lucky to have one here that I manage, and they're a great resource as well. But again, I'll make the point, data and engagement. Start utilising your data, build your business case to implement senior management to get the buy-in, and that will get the long-term support. And if you could summarise occupational health or health-related issues, it is very multidimensional. It affects individuals differently. And one of the issues is it could be delayed consequences. It's not immediate. You can't obviously see it straight away, and you need to influence senior management. Most universities approach this different ways, many different departments. So you do need an organisational approach. You do have to pull various people in for a common goal. So it's not easy, it's difficult, but there's enough tools there to pull it together, and that should get the long-term buy-in. I've pinched this slide, I will claim. A colleague of mine, Professor Budworth, I seen at one of the talks we was having, I thought, you know what, I'll take a quick picture. And sometimes you can just present a little timeline of what might happen. You can talk a lot, but if you look at a wonderful situation, a very healthy psychological contract, situation's fine. Challenging, demanding work, highly rewarded, nice environment. Some little trigger happens somewhere along that line, things start to slip. The manager doesn't pick her up, the employee doesn't speak up, or is not aware, and we start to suffer. Presenteeism creeps in, absence creeps in. None of these signs are picked up by management. lack of training and skills, etc. And then we start seeing absence. Do we communicate when people are off sick? Regular communication, that drifts into long-term absence. And then sadly the person leaves. That timeline is so, that could be 6 months, 12 months, 18 months. There's no real time frame on that, but there's enough triggers there with the right skills in place to prevent that person leaving and keep that wonderful place there. So I'd just like to finish off by promoting some of our bestsellers, should I say, want a better word. These are some of the publications we've produced over the years, highly respected by people who use them and people who contributed to them. There's a leadership and management of how you manage health and safety in an institution. Freely available from all institutions should have them or be familiar with them. That's gone under a nice little review now. It's well respected and well done. And you can see the colleagues who we've worked with to produce that. Again, guides for managing stress within higher education. Again, another well-respected document, which kind of also highlights a model about the whole university approach. So again, some good authors, and I think Nicola, your colleague, Paul, was a creator of this document as well. And again, linking in with Alex and trade union colleagues, with work with UC to produce a wide range of materials, again, to just little toolkits there that might just help new ideas, new initiatives. So there's just little like a bit of a background, a context of what it's like to work in the sector, what controls should be in place, and how if they are, it works well. And if they're not, and if there's gaps, you can see where things will deteriorate and affect the health and well-being of individuals. On the survey itself, a very helpful survey. There's been a lot of helpful comments made on it. I think we kind of very helpful. It is a small sample size, so again, let's not say that this is representative of the sector, but it's hard to see that there's not an issue to pick up on somewhere. There was a couple of interesting points in that.
Vincent, sorry, I'm going to need to draw you to a close. So sorry.
That's more. I'm more than happy with that. I'm sure it'll come out in the conversation anyway. But thank you very much.
Thank you very much. Really interesting stuff. And actually, people are also putting resources and things in the chat, and I'd encourage them to keep doing that, to share. And any specific questions, of course, for Vincent, please do keep a note of that so we can add it into the panel session. So I'd like to invite our next and last speaker for this part, Joe. Joe, if you would like to come on screen and introduce yourself, please.
Hi, everyone.
Can see you. And
can you see me?
Yeah,
great.
brilliant.
Thank you. Hi, everyone. So my role at the University of Derby is Head of Equality, Diversity and Inclusion. And a couple of years ago, it was broadened out to include responsibility for wellbeing. So I want to say at this stage that I'm not a HR person, in that I work closely with colleagues within the Directorate of HR where I'm located, and I do that to embed wellbeing in the people experience. So the delivery of wellbeing at the university where I work is divided between two teams. So my team does all things proactive engagement, stakeholder management, training. We manage the employee assistance programme, and the health and safety team who look after occupational health, all things related to compliance, working towards ISO 45003, I think it is, and both teams collaborate where there's an interface on our wellbeing framework. But this realignment of my portfolio, I think, the reason I want to talk about it is reflects our broadening approach to wellbeing at the university. We see wellbeing as an holistic, from an holistic point of view, and we realise that there are many elements to consider that promote wellbeing. So could you pass the next slide, please? Thank you. So today I want to talk about taking an holistic approach to wellbeing, and in the process I'm going to cover some of the challenges that we face, how we've approached wellbeing, how our approach to wellbeing helped us when COVID struck, and then I'm going to talk briefly about positive absence management, giving you an example of some best practice using a COVID case study. It's brief today, so I've picked out the highlights to show it in action, and I just wanted to say that we're still very much on this journey. So at Derby, as I said, we're taking that strategic approach to wellbeing, building an holistic whole organisation approach. Our wellbeing framework is underpinned by the 8 pillars that you can see. emotional, physical, spiritual, environmental, occupational, social, financial, and digital. And we're mapping these pillars against areas of responsibility across the university and into our processes. The purpose of the framework is to establish wellbeing as the norm and not the exception, and to broaden our understanding of it and engagement with it. There's lots of research out there which talks about the benefits of creating an holistic system that enables people to be their best selves in the workplace. So Cooper and Hesketh, for instance, talk about it from the point of view of connection, enabling employees to make a connection between the meanings they have in their life and back into the workplace environment. So we're evolving our approach to wellbeing and expanding our baseline beyond managing absenteeism and OH processes and mental health support to take account of other positive influences on wellbeing. If I could have the next slide, please. So, for example, we've got 5 very well attended staff networks at the university. We've got the Gender Equality Network, Race Equality Network, the LGBT Staff Network, Faith and Belief Network, and our Disability Access and Wellbeing Network. And they offer staff a safe space for open dialogue and peer-to-peer support. Our chairs help to shape the awareness raising that we do, and the membership provides valuable lines of consultation, enabling the employee voice. But as well as supporting cultural change, our networks also help to build trust and respect, which enables people to thrive. I know that we're not unusual in having staff networks, but I think we might be different in that we place a wellbeing value on their role within the university culture. And I wanted just to give you a few examples of what I mean by that. So next slide, please. Next slide, please. Oh, can you go back one? That one, thank you. So during lockdown, the networks worked hard at keeping, next one on, please. The one with the picture. That's it, great. So during lockdown, the networks worked hard at keeping people connected to the university, because we know that lockdown created both a geographical distance for people and also an emotional distance for some. So collaborating with our students, this is an example of one of the projects that we did, which was a digital piece called Apart While Apart. And the idea was that everyone submitted an image of something that was precious to them, that helped them remain connected both to colleagues, to students and other students, and also to the university. And then our students brought in their tech expertise and helped us to put all of this together. It was curated as well through the colours of the rainbow, because that was emblematic of the support that was being shown to the NHS at the time as well. So while working remotely then, all of our networks continued to meet with regularity. And it was here that their asset to wellbeing started to shine through. So seeing the rise in hate crime incidents generally, which spiked during lockdown, particularly for people from the LGBTQ plus communities. Well, our LGBTQ staff network anticipated that for people who were not out to their families, then lockdown could very much become part of an alienating and potentially hostile environment. And we know this because some of our staff at work who were part of the LGBTQ communities, they chose the LGBT network to become their chosen family during this time, because their own family didn't share their lived experience. And similarly, when George Floyd was killed in the States, the Race Equality Network opened its space to care for Black colleagues, giving time, space and compassion to help people process what had happened and deal with any triggers that had developed as a result of that. So you can see the positive benefits that the EDI networks have on people's sense of self, and that has enabled us to map their value directly into the wellbeing framework through the various pillars that they relate to. But we also apply trend analysis from the Employee Assistance Programme report to anticipate and intervene where we see peaks and troughs. If I could have the next slide, please. Thank you. So looking at the top 5 reasons for calls to the EAP, we can see where we are below, near or above the client group benchmark. Now, I have to say at this point that the EAP is available to staff 365 days a year, 24 hours a day, and it can be accessed via an app, via online, email or telephone. And the service offers structured counselling. So each time a member of staff contacts them or a family member contacts the EAP service, they're triaged by appropriately qualified and skilled counsellors at the other end. But as was just mentioned, the EAP is, you know, its value is so much more than that. But we receive reports each quarter, and I know, for example, that in January, February and March of each year, there is peak demand from our staff calling for relationships and legal assistance. Now, in all of our communications, we always flag up the EAP because we think it's a brilliant resource that we make available to staff. And we use those communications to link back to the resources. But we know from the data that I've just mentioned that, for instance, during COVID, when domestic abuse was on the rise, we used the data and the national picture to come to the decision to bring Refuge into the university to run domestic abuse training for our staff, and in particular for our managers, to help spot the signs of domestic abuse and offer the appropriate support. So this awareness raising meant that our managers felt confident speaking to staff about domestic abuse, and were able to provide an alternative space for some staff who were actually experiencing domestic abuse. And that enabled them, when they were working remotely and experiencing that, then the managers facilitated a move onto site, protecting that individual, and they were able to work on site. So part of the wellbeing framework then concerns the competencies of our managers to effectively manage from a point of view of wellbeing rather than managing wellbeing. So we wanted to sort of change the discourse slightly with that nuanced difference. So during remote working, we enabled staff to work on site if their wellbeing was affected. So staff living at home, sometimes in shared spaces, living with mental illness, so suffering from loneliness, for instance, anxiety, based in small bedrooms, all sorts of reasons. If a manager picked up that a member of staff was experiencing distress because of reasons like that, then a request was put through to senior leadership, and a move to work on site was usually facilitated in a COVID-safe way. But now we've moved to a permanent, flexible way of working, and I appreciate we've been talking earlier about what flexibility around that means. What we've done is we've looked at this through team agreement. So we've gained consensus between staff about what that means to them, and we're offering staff control and input into that process. And at the same time, we've done this in 2 phases so that we can review the impact from various angles. Wellbeing is one of those angles. So the finding of the report, that's sort of the central focus of today, tells us that investment we make into awareness raising can sometimes be seen as less helpful to staff than actual institutional change. So I think taking an holistic approach to wellbeing speaks well to this point of view, because it underscores the relationship between the manager and the employee, especially when we look at positive absence management. So a typical absence management system will send out email reminders with fit notes are due. It provides a process to document handling and everything that you would want from an admin system. But we require our managers as well to have high levels of emotional intelligence when dealing with people's well-being, when dealing with people when they're off sick, and that isn't always in high levels. It's consistent levels of emotional intelligence can present challenges, therefore, to maintain those consistent levels. So, for example, our managers understand that mental health is a priority, but are not always sure how to approach this. They're not always sure about what's the right way, the right thing to say, for example. So while a system provides a prompt to keep you in touch, which is great, it's the look and feel of that contact that matters to the individual. So to assist us, we offer training to our managers, our managing staff, from a point of view of emotional wellbeing. And this includes the quality of the return to work conversation, which we have now enhanced through a wellness action plan, which is designed by Mind. To support our approach as well, we participate in the mental health productivity pilot, which gives us the benefit of accessing free mental health training for staff and managers from the point of view of taking care of managers as well, because we realise that, you know, as we've talked about already, you are shifting the onus of some of this onto the manager workload. So it's important that we take care of managers and that managers know to take care of their own mental health and wellbeing. And we've made very good use of this offer as well with the mental health productivity pilot. It also incorporates man's mental health at work commitment, and we've continued to train mental health first aiders during the remote period. We're about 50% of the total number of mental health first aiders in comparison to physical health first aiders. So we're working to try and close that gap all the time. I just want to finish off then with a quick case study. So the next slide, please. Oh, that's it, thank you. And this case study nicely rolls together the benefits of hybrid working, the impact of COVID, and an example of positive absence management. So this is about a member of staff who went on to develop long COVID, and this put them off work for a considerable and extended period of time. And it took many, many months to get that member of staff to the point where they could consider returning to work. And coming back to work started with a few hours of work each day on a phased return. So countless months down the line and numerous OH reviews and GP notes later, we fast forward to the approach taken on to the phased return. And this is really the key point I want to focus on. Because the manager had maintained good face-to-face conduct with the individual throughout their period of absence, they learned to recognise the signs of fatigue, of panic and emotional overload, some of those subtle changes that the individual was experiencing, that signaled to the line manager when they were talking to them that an intervention was needed at that point. And this was at times when it wasn't always apparent to the individual because long COVID had removed their self-awareness and their filter. So when the phased return was planned, the manager structured the return both from the point of view of incremental increases in hours, but in a way that compensated for cognitive functions that had been affected by long COVID. So it was there to orientate and to maximise recovery time for the individual, and gave freedom of expression to be creative, but also, you know, gave that momentum to complete tasks and to gain work satisfaction. It enabled them also to remain working remotely, and which managed their anxiety about coming into contact with COVID again with large numbers of people. It was a plan of work that was written from the point of view of wellbeing, and this was supported by a wellness action plan that was completed swiftly from during the first week of return to work. And instead of that becoming the return to work conversation becoming a tick box exercise, the plan actually became an agreement between the manager and the employee, which was framed around emotional wellbeing and safety of the individual. And so my final point as I finish is some of the key challenges that we faced in embedding an holistic approach in all areas of university life. And as I say, we're still on this journey. But one of the key messages, I think, which is also a challenge, is about the need for stakeholder allies to help embed an holistic approach in all areas. So for instance, to give you just a quick example, in our new builds, we've worked hard with the states to build wellbeing into that design and development process, so that wellbeing becomes the norm rather than the exception. And a very obvious example of that, because we know that sitting is going to be the new smoking, as I've read in future, is that stand desks, for example, are readily available for all staff to use, rather than being seen as a reasonable adjustment for those that need it.
Brilliant. Thanks, Jo. That's great. So we've had a phenomenal amount of content. So actually, in the interest of wellbeing, before we go to questions, I'm going to encourage everyone to stand up for a minute if it feels appropriate and safe to do that. I'm going to do it too. Just give yourself a little bit of a wiggle and a movement, especially the speakers, because they'll be supercharged from what they've just done, and just kind of move in our bodies. You know, we have to practice what we preach, as we've heard from everyone. So this is now a chance for you to put some questions both to the speakers and some panelists as well. We also have Faye McGuinness from Education Support, and Ruth Levin from Unison, Eleanor Dommett from King's College London, and Abigail Hirschman from the Charlie Waller Foundation. If you have a specific question, please say in your question who it is to. But as you're thinking about that and putting it in chat, and I'll try and keep an eye on that, we also asked everybody, all our speakers, to identify one change that they thought would make a difference to the wellbeing of employees in the sector going forward. So if they haven't said it already, that's also something would be great to hear from people. And Nick has put all the details of everybody who's on the panel. So if we have a specific question, I can't see a specific question as yet to a person. Obviously, reflectors, give yourself times to come up with it. But perhaps I can just come to some of the themes that have come through. So we've talked about the issues of hybrid and flexible working, the idea of where systems support mental health and well-being in organizations, and this notion that relational or emotional content is not a soft skill. These are really complicated things to get our heads around. And also thinking about role boundaries and role definition. Those were part of the themes that came through. We had a nod to the ISO 45003, and the other bit of legislation will be the NICE guidelines that come out in March about mental well-being at work, both of which focus very much on line management skills and support for line managers. Here we go. So from David, can I direct my question to Faye? A lot of the burden to look after staff well-being, etc., can be laid at well-being team, which do not have the ability to implement change that can only come from a senior level. Question: what do you think is best practice for individual institutions and also jointly on a national level to get buy-in from senior levels? That's great. So that's from David to Faye.
Well, firstly, just to say this has been absolutely excellent. We are really pleased to have commissioned this report as the only UK charity dedicated to supporting everybody that works in education. It was really important for us to build on the excellent work that Siobhan and Gail have done previously to look at what the current state of play looks like. So I think what's really clear is that this can't be done at any one level. And I think I put this in the chat already. We have to look at actually what the role is of individuals in terms of looking after their own mental health and well-being. And when I talk about individuals, I think we're talking about three areas here. In any workplace, we will have people that might be thriving at work and sort of working at their most productive and feeling their most engaged. And we would call those the thriving group. But then we have a group of people who might be struggling at work. And actually that group has increased during the pandemic. And we need to make sure that we have support available for that group of people who might be in work, but struggling. And that's where we see the real issue of presenteeism. But then we need to recognise that we have people that are ill, they're unwell, and they might be unwell at work, or they might be taking time off work. But when we're looking at individuals, we need to look at all three of those areas to make sure that we're providing adequate support. So that's the individual level. We know that the biggest change will happen at the organisational level, and that's a lot of what we've been talking about. And I think the reality is that there are no easy answers to this. If there was, the report would have said something very different. We're about to publish our Teacher Wellbeing Index, the 5th that we published at the end of this month. And it's important to say that these issues are not unique to the higher education sector. They are the same issues across the whole of the education sector, and they're the same issues that are across all sectors. So I think there's fundamentally something here that we need to identify about what is the good practice that we can collectively see, what are the challenges that we continue to see in terms of tackling this at an organisational level, and then the third area that we need to look at is the system. You are operating in a wider system, and we know that those issues and those systems can sometimes contribute to poor mental health at a workplace level and at an individual level. So I think that good practice, you have to look at all three of those areas, and no one organisation can do this perfectly. And that's why I think there needs to be much more collaboration in terms of identifying what those issues are and how we overcome them. I think that we put a lot of pressure on line managers, understandably, but we often see that line managers are those that feel least psychologically safe in their work environment. And that's why they often deliver line management under policy and practice to the letter and not necessarily look at individual circumstances. So the line manager piece is really fundamental here, both in terms of them being able to support these staff, but them also feeling psychologically safe themselves. So yeah, that's my reflections. Really interesting conversation and lots for us to take away in terms of how we support the sector.
Brilliant. Thanks, Faye, so much. We have another question in from Michael, research leader in health, work and wellbeing. And his question is for Gail or Siobhan. Great set of presentations. His question is, have you seen anything in the research that is very different to other sectors, which Faye just kind of connected to actually? Many of the points presented can be seen across all workplaces, and I wonder if you had to choose 2 or 3 things of difference, what would they be? So what have you seen in the research that's different to other sectors? And if you had to choose, what 2 or 3 things differences would they be? So either Gail or Siobhan, if one of you would take that, that would be great. Gail, you're on mute.
Sorry about that. Maybe we should do one each, Siobhan. Certainly for me, it's the role creep. And I think a lot of people would agree with that. Looking at academics in particular, we know that we have to demonstrate excellence in lots of different areas, and the expectations for the role as such tends to be increasing. It's no longer teaching research, it's no longer admin as well. It's also the pastoral care that was a big issue, I think, and I'm sure you'll agree, Nicola, during the pandemic, and is still continuing. And all other things like IT specialist, and also having to keep up with your area of expertise as well. So it's the being pulled in all these different ways, really. Siobhan?
Right, trying to unmute myself. I think it's related actually, and I think it's an issue. Would I say it's just an issue in higher education? Probably not, but I think higher education is a particular problem with it, which is this idea of resource. And when we talk about sort of health, I think I saw somebody else in the chat about, is it just a health and safety thing? And I'm not sure it is, because a lot of the things we see around workload, role creep, etc., are related, yes, to individuals' well-being, but they're also related to how resource is distributed within the institution. And institutions can have very, very different experiences. Again, I'm speaking from an academic perspective, but very different experiences from one department to another, depending on how workloads are organised or managed, what expectations are around, marking, etc. So I think that there are issues around resource and how. I think in higher education, I'm absolutely right, and I think that practitioners and academic support and support staff are all very, very student focused actually in UK HEIs. I think we are very, very student focused, but I think with that comes the challenge of trying to do significantly more with significantly less. So I think it is a senior management. Well, what can we achieve with the resources that we have? And I think that that's one of the biggest concerns for me in higher education.
Brilliant. That's great. Thank you. We're not going to get to all the questions, I don't think, now, but we have a question from Andrew to the panel, and I'm going to suggest maybe we hear from people we haven't heard from yet. So Eleanor, perhaps you and Abigail wouldn't mind answering this. How do we influence senior leaders to address sources of psychosocial hazards? If you have thoughts, of course. I've put you on the spot, sorry about that, but either Eleanor or Abigail, if you have like to respond.
Yeah, so I can say a little bit about this. I think it relates back to the previous point actually, that we are a very student focused sector, which is good for many reasons, but what you typically see is the amount of effort that goes into supporting student wellbeing is not mirrored in staff. So actually I think one of the big influences is almost going to be a case of getting students to see us for who we are, because when the students start to express concerns about staff wellbeing, I think the sector has no choice but to listen. And you know, the pandemic's done lots of things, and we hear about them all the time, some very difficult things. But one of the things that I think has been quite positive about it is there is something about students seeing you as a real person when you're sat on your sofa with a child in the background, you know, building works being done, the pet cat walking across your laptop, whatever it is. So they start to see us as real people, and that is constantly challenged by the fact that we might have one academic staff member or one professional services person dealing with hundreds of students. So it's hard for them to see the person. But I think a key influencing factor will be for students to start recognizing that staff will only do their best job if they're in a good place. So I think that's one of the key influencing factors. And then the other one is probably just repeatedly reinforcing the message that, you know, we need to have that adequate support. And that's difficult to do because of stigma.
Thanks, Ellie, that's brilliant. Abigail, do you have some thoughts that you'd like to share?
Yes, hello everybody. What a great session, so much interesting content. It's interesting though, Gail, to see those slides that I first saw in 2015 and seeing, you know, where they've gone and where they've come to. So I think pragmatically, organisations, universities are huge, complex organisations that are full of varied roles, varied interests, people who are coming from different positions. So I think a pragmatic approach is often needed about how we can actually deal with those. The CMHA does a thing about hub, spoke and wheel approach. So thinking about what you want to do centrally to affect change and what you actually need to devolve locally to your different teams. So when we talk about psychosocial risks, what are the psychosocial risks if you're a member of an estates team compared to if you are an academic staff member who's traveling around the world? Those are entirely different. And I think in terms of senior leaders, it'd be interesting to know whether there's any senior leaders here today. I think as soon as you put psycho in front of anything, there does tend to be a turn off, and actually that sits over there, not within my remit. And I agree with Nick's position at the beginning, in terms of work that we've done where there's really been a change, there needs to be a policy and what's in it for that leader in terms of actually, because I worked in HE for 15 years, I've been out of it for 7 years, and I'm not seeing things. The narrative is getting stronger, we're talking more about this, but the actual change is not necessarily going as fast as maybe it should, whilst there's so much great work being done as well.
Right.
So it's yeah, what's the hook for them, really?
Yeah, what's the hook for them? Lovely, lovely. Great to kind of bring it back to that as well. Abigail, thank you. Yes.
I was trying to find the hand on Zoom, and it's not familiar with that one. Just a quick point about engaging and influencing senior leaders. Agree with the comments made, but what you'll find across all institutions is, I'll just say, a lead director for health and safety at the very top of the institution. Now, I'm not saying it should be this individual, but if we're looking to engage with and influence the actual top, there's a route in straight away through that person. Now, I'm sure, and the language will be similar, they will understand the issues, and the representatives at that executive board level, shall we call it, senior leadership team, will be able to interpret that in terms of their own school and professional service. So there's a route into the top, and it's about how you influence that person. And I'm very confident they would be on board already because of the role for health and safety as well. So there's a route into the very top as well as the various layers of management, and it's just influencing that person there through a variety of ways can do that.
Right, thanks for that. That's really helpful. So again, but it's finding your person of influence, isn't it? And building those relationships that's coming through. We might get 2 more questions maybe in. So one from Paddy, because I know Nick wants to summarize as well. So Paddy's question is about, and this is to Gail, thoughts on gathering data and sort of wondering about using surveys. And the question is there a case for asking questions that you mentioned in your psychosocial safety climate slide? Should surveys like this be one and the same thing or treated differently? So where do we collect the data from people? What are your thoughts, Gail?
I think there is a very strong case for using this benchmarking approach where you're using the same questions again and again, you know, at a national level, but whereas you can also use it at a local level. So you can pinpoint perhaps the hotspots in particular institutions and also the trends at a national level. But that's not to say that a generic approach like the HSE management standards covers everything, because we've certainly found that there's a lot of sources of pressure in universities that are more job specific. So we do need to try to capture these and also perhaps assess them on a year-by-year basis, because in the 2014 survey, we found that change fatigue was a massive issue. You know, people were perceiving huge amounts of change and perhaps being quite resistant to change. So it's trying to identify the key issues that are specific to the sector and build it in as well to a national survey and perhaps also at local levels. So I hope that's answered your question.
Great, yeah. So there's something about collecting the individual information, but linking it in. So there's something about our context, isn't it? Bringing ourselves into our smaller, medium-sized and larger context to help make sense of the data. So let's try another question now. This is from Ian, but Ian, you don't say who you might like to put this question to. So it's generally to the panel. So perhaps the panel can think about answering. The presenters and findings in HE appear to be twice that of the NHS, with demand on teacher research income generating lead teams. How would someone on the panel propose to give permission for staff to actually go off sick and recover fully before returning to work? And I don't think we haven't heard from Ruth yet, actually. Ruth, I don't know if you might want to respond to this.
Yeah, thank you very much. And I'd also like to say it's been a really, really fascinating session and something that, you know, I hope we can really continue. In terms of the issue of this particular issue around presenteeism, and I think there are probably a number of factors. There have been some brief allusions in today's discussion around funding and the pressure that staff face to be at work. And I think this is something that, you know, as a sector, we probably need to collectively grasp the nettle. There was issues that came out in the findings around, for example, the administrative burden on academic staff and where that should lie. And I'll be really interested to continue the research with you to get the whole picture of the whole institution, including university support staff, so that we don't shift the problem from one part of the workforce to another, because I think people experience work pressures in very different ways. I also think there's probably something around higher education to do with the hierarchies that we have in our institutions with very hierarchical organisations. And I think there can often be a downward pressure and a lack of confidence that has come out through the surveys around being able to speak out, to not face that stigma that the report highlighted or the fear of failure. And I was really interested in Joe's comments around integrating equalities and diversity along with well-being. And I think it really goes back to that cultural change of not having siloed discussions around health and safety and well-being, but also and siloed discussions on equalities, harassment and discrimination, but bringing together that those different areas of change that are needed, because we know very well from reports that there's a really important need to address, for example, racial harassment, exclusion and discrimination, because that has a massive impact on proportions of our workforce in relation to stress, anxiety and potentially well-being and mental health. So I think that there's definitely a resourcing issue that we have to grasp, but it's also giving people the confidence and the permission to come forward and ask for the help that they need, and for universities to be able to respond supportively to that.
Thanks, Ruth. That's a really full response to that question as well. So I think we might just get one more over the pass, and perhaps if I put this to Gail. So the question is asking about sector level changes, and perhaps because you've done this research over a period of time, it might help us with the perspective. And the question is from Richard, wondering about higher education institutions becoming more stressful organisations than perhaps other organisations in different sectors. How could these changes be ameliorated, addressed, or reversed, or can they? So it's quite a big question, Gail, but perhaps if you could give us a kind of a summarized sort of answer to that, that would be great. And then we'll move to a finish. I'm really sorry for all the questions we can't answer, but we'll capture all of that content at the end as well.
I do have to say that there's been some wonderful questions and observations and sharing of resources. So thank you, everybody. We need to preserve all of this, don't we? Okay. Big question. Not sure I'm going to be able to answer it in about 30 seconds, but I think, you know, again, we're pushing this multi-level systemic approach that's very much evidence-based, but also is involving staff at every step of the way, because, you know, we then have interventions that are fit for purpose and what staff need, and revisiting it on a regular basis, you know, to pick up these kind of up-to-date challenges that we all have. So I think it'll be a work in progress, but certainly I think we've seen today that change is most definitely needed. We have a lot of the information that we need to actually move forward, but we need to move. We need to do something, and I think that's the big priority at the moment for me.
Thank you, and I guess just to encourage anyone, if there's a resource in chat that you need to take away, grab it. Don't miss the opportunity, or a connection that if you've seen somebody say something that kind of resonates for you, or think that they might be an ally, then make sure you make a note of that person too. But thanks again hugely to the presenters. You know, those were short times, and I really appreciate it, and for all of your engagement as well. And Nick will see us up to the path. Okay, thanks, Nicola. 2 minutes sum up, and then we'll close at 12:30, although we will keep the Zoom open. If you want to chat or connect, do that. I mean, I suppose, you know, there's a real problem in higher education. It is not good enough what is going on, people working in hospital beds, the whole culture. It's a real problem. And we, as I said at the top, you know, we look at different sectors in occupational health, and some sectors are working hard to improve. The military are actually very good. Others, there's a real problem, and there is a real problem here. There's no doubt about it, and things need to change, because you know, both my parents are academics, and they seem to have a lovely life. You know, one of them's still alive, and you know, those are nice days. What has happened is definitely something's gone badly wrong, and it's not your fault, but things need to change. I think so. It's the first place to start. I think, you know, get your data right, understand what's going on, so you can make the case. Get your strategy right, and, you know, get the good practice that's been shared here. And part of that strategy is management and leadership and the culture, and get that buy-in at the top level, and choose your moment, you know, sometimes related to awareness days or mental health awareness days, etc. But get that buy-in, and, you know, use this as evidence. And you know, I'd like to thank the people who've engaged at the national level. You know, we want to help at that national level. If we can help regionally or locally, you know, Tom's happy to help. But, you know, the people who've engaged today are the unions. You know, thanks to the unions, thanks to Charlie Waller, education support, others, you know, who are leading this area, and, you know, well done for getting the buy-in. But frankly, you know, when particularly Gail sort of organised today, and a big thanks to her, we did not get buy-in from certain people. And, you know, I don't know where the Universities, Colleges, Employers Association are, but, you know, maybe they are here. But where's that engagement? Million plus. I mean, I don't know. Maybe they're here, maybe they're not. But why aren't they engaging on this issue? And we would want to take that forward, as we did with the mental health nurses and doctors, and you know, have a reasonable conversation. We're not, you know, we're a professional organization, we're evidence-based. You know, Gail's done the research, it's pretty clear what it is. So we want to engage that. You know, there's people who are specialists in areas like education support, and Charlie Waller, you know, they will be taking this forward, and we're happy to help and work with them on that. So do contact us, or you know, people from Charlie Waller and education support. So finally, you know, big thanks particularly to Gail, Siobhan, to you, Nicola, all the speakers. It's been a really good morning. There's more to be done, as I said, so let's keep the session going. Do contact us. We'll share the recording with everyone, and I think we'll just call it a day now. Have some lunch, but if you want to have a chat with each other, we'll keep it open and just make those connections.